So good evening, ladies and gentlemen. Welcome once again to yet another interesting topic that we have actually treated before, but due to popular demand and as a result of the high frequency or the number of patients that are coming around for this same health condition, we found it pertinent to address certain matters and certain issues that are attached or linked around this condition. What we were watching before now was just a preamble, just to warm us up for what we're about to talk about tonight. And I'll also suggest that we bring out our biros and papers, begin to write down our questions as we move. In case I'm moving too fast because of time, I hope we may round off in the next 30 to 45 minutes so that we can all ask our questions and also enjoy the interactive session where you can ask questions and you can bring any topic from any aspect. It mustn't be only sciatica. Any health condition can also be discussed. No one is an island. You can contribute, you can discuss, consult, or anything. We have our health practitioners also here waiting as well. Other health practitioners are here waiting as well to also answer questions in case you need. So, without much ado, I'll say welcome to this interesting topic called sciatica. And I remain my humble self, Lucky, Dr. Drugs. And I'll be talking about treatment. But the real question here, that's me, Dr. Drugs. The real question here is embedded in our table of content. Our table of content goes thus. We can't be talking about sciatica without talking about the human bones and joints. We can't do without talking about spondylosis. Sometimes we hear lumbar disc bulge. What is it? Lumbar disc herniation. What is it? We hear about stenosis. We hear about issues that have to do with the sciatic nerve. What is it actually? What's the sciatic nerve? Then we have to ask ourselves certain questions. And what is the relationship between sciatica and obesity, high blood cholesterol, massaging? Why do people have a higher tendency to have sciatica when they have these conditions? Then we'll also have to talk about the causes and risk factors. We'll run through very quickly because we have run through these before. Now, as we all know, the human bones are what gives us that our body, that structural integrity, is the internal support framework of the body and is made up of bones connected at joints. So it's what makes our bodies or our bones form a structural whole. There are certain molecules or atoms that are not left out, for instance, calcium, chondroitin sulfate, and phosphorus and all that. Talk about that shortly. Then joints are connections between bones that link the human skeletal system into a functional whole, as aforementioned. Then we have cartilage, which act as paddings. Now, if you look very closely, this is where we're going to come to very soon. And you can see this very lovely bluish padding here. This is where the problem comes. You can see the inner portion looking so smooth and shiny. You can see the outer rings that protect the inner portion. And where there's calamity in this area, the nerves that are behind and to the left and to the right of this, of the posterior aspect of this lovely padding you see. And an inner softer part of this intervertebral disc is mostly made of proteoglycans with high water retaining capacity. We're talking about 70 to 80% of its composition being made of water, and it's called the nucleus pulposus. And that's why you find out that we always say that one should be highly hydrated as much as possible because we need that area to have enough water. Cartilage is very easy to understand by looking at this picture. If you have a car and we hear about what is called bushings, you can see that these are what get damaged when the joints get compromised, and of course leading to those crackling sounds that people hear. This is what the chondrocytes or the cartilage look like under the microscope. But we're going to focus more on something that has to do with what is on the right part of our screen. You can see what a healthy spine looks like with the lovely blue bands that are padding them. And then you can see a damaged spine that has been damaged as a result of spondylosis and can lead to sciatica. So spondylosis, briefly, is simply osteoarthritis of the spine. And it's also known as age-related degenerative disc disease or degenerative disc disease, also known as DDD. Of course, spondylosis or osteoarthritis of the spine can cause lumbar disc herniation. And spondylosis is the degeneration of the spine that can cause the disc to lose water or hydration, leading to tears and weak spots in the outer part of the disc. The fibrosis, which is the outer part of the disc, and that can cause soft the soft inner part of the disc of the nucleus pulposus to leak out and bulge, and that's what we're talking about, disc bulge and all that. So lumbar disc bulge, we just mentioned that not too long ago. Lumbar disc bulge is a condition where the spinal disc protrudes beyond its normal boundaries but does not rupture. That's the difference. That means it has actually gone beyond the normal boundary, but it did not rupture. It did not go beyond that point. And of course, it can put pressure on nearby nerves, causing pain, numbness, and weakness in the lower back and legs. You see, we're already getting to the promised land. We're getting to our destination. It's often caused by age-related wear and tear, injury, or degenerative disc disease. A bulging disc is a common cause of sciatica. So that's why in some results, you see they write disc bulge at L3, L4. But what is disc bulge? This is what disc bulge is. Now, disc herniation is when we say that, some people say that it is from clap that dance begins. Now the dance has begun. The problem has actually begun to take very good shape. It occurs when the soft inner part of the spinal disc or the nucleus pulposus bulges out through a tear of the outer part of the annulus fibrosus, just like in a vernacular, they say tire don burst, in short. Putting pressure on nearby nerves. Bear in mind that the sciatic nerve root is somewhere around there. And this can cause pain, numbness, and weakness in the lower back and legs. In short, the whole summary of this is just the adventure of sciatica. In short, this is how sciatica starts. It starts from either disc bulge or lumbar disc herniation, and then that's now spondylosis, and then it migrates into compression of sciatic nerve roots, giving that symptom, sensation, on that problem called sciatica. Now, the sciatic nerve itself will not be left out. We need to talk about it because that is where the problem emanates from. If you look very closely at this part of our screen, you will see that there are some things like yellow wire or yellow cables coming out from the lower back here. If you look very closely, you will see that. And these are the sciatic nerve roots emanating from the intervertebral discs. You can see how lovely this depiction is. You can see L3, L4, you can see L4, L5, you can see L5, S1, and you can see how the sciatic nerve root emanates from there. And that's why you feel the pain shooting down the leg. You can see where it's going to. Look at the picture closely. That is what is sciatic. It's actually the longest nerve in the body and runs down from the lower back to the legs. Why does it give this sensation? The sciatic nerve controls muscle function and sensation in the legs, including the hamstring, the quadriceps, and the calf muscles. It also provides sensation to the skin of the legs, feet, and toes. Some people say they are feeling tingling sensation. Some say it's numbness. Some say it's all forms of things because the sciatic nerve root has been compromised, and that's why you feel those sensations going down through the back of the thigh all the way down to the leg. And that's why we're going to find out why it is very important to tackle the risk factors we're going to talk about shortly when we're taking care of this condition. Now, sciatica is a symptom characterized by pain or shocking. Ladies and gentlemen, we have arrived. Now, we're talking about sciatica today. We've had a preamble, and now you can see that there will be numbness, tingling, or weakness in lower back, hips, and legs. And it occurs when the sciatic nerve, which runs from the lower back down to the legs, is irritated or what? Compressed. This word compressed should be underlined. Take very good note of it because a lot of people like to massage and destroy their backs. Their children should go and play on top of their back and all that in the name of massaging it. We'll see whether that's going to help us or not. And the sciatic nerve is the longest nerve as aforementioned. And of course, when it is irritated and or compressed, it leads to sciatica. This is what it looks like actually when we're looking through. Let's assume we're like Superman or something and we have X-ray vision, and you will see that this is how it emanates from the lower spine, lower back. Then we have cervical spondylosis. Let's not leave that out because it can lead to cervical myelopathy and radiculopathy. That's when people have similar sensations as they have in the legs, in the hands. Some people, there was a patient I had that was crying because she discovered that she could not raise her hand up to spread her clothes. Then she called me on the phone that she began to shed tears. She doesn't know what's going on, but she was having cervical spondylosis. Of course, lumbar spondylosis is not left out, as we know that that's what actually provokes and or promotes sciatica. That's the Don King of sciatica. The way Don King promotes boxing, that's the way lumbar spondylosis promotes sciatica. Now, what are the causes and risk factors? Lumbar disc herniation, we just talked about that. Degenerative disc disease, spondylosis, talked about that. Herniated disc, spinal stenosis, which means narrowing of the spinal canal, which can compress sciatic nerve, and you know the rest is history. Piriformis syndrome is not left out. Spinal injuries or trauma. Spondylolisthesis is slip vertebra that can put pressure on the sciatic nerve. You know what will happen. Of course, spondylosis is not left out. Aging, genetics, not left out. Because aging is important because daily wear and tear can lead to this. Obesity directly exerts pressure on that area and helps what to grind the intervertebral disc and lead to sciatica eventually. Menopause, of course, estrogen helps maintain the structural integrity of bones and joints in women, including the vascular integrity, that's blood vessel integrity, including the heart integrity. In fact, menopause is just, I don't know what to say. It's not a disease, but it comes with a tsunami of complications, and spondylosis and sciatica are not left out as a result of a drop in estrogen level of female sex hormone. Lack of exercise is also very, very important. I keep waking everybody up around 5:30, 6 a.m. to go for exercise because I know that exercise can actually stimulate what are called somatic stem cells in that area to provoke healing. We're going to find out whether it is possible for one to have to avoid surgery in certain situations without or not. We're going to find that out together. You tell me at the end what you think. Diabetes, let's not forget that the outer ring of the intervertebral disc is made up of what? About 70% collagen. And we all know that sugar destroys collagen. That's why it's that when people have diabetes, they age faster because the collagen in their skin is already getting destroyed by the sugar. And of course, sugar leads to excess formation of free radicals and all that also attack DNA of the cells around there and cause a lot of problems. Of course, jobs with high joint stress can also provoke spondylosis and in turn sciatica. So what are the signs and symptoms? If you look at the picture at the bottom right of the screen, pain is number one. That is what makes people, they can drink anything, buy anything online, do anything because the pain is horrible. But unfortunately, it's not a function of how much you spend. It's not a function of what you are drinking or doing. But at the end of the day, it's whether you are doing the right thing or not. Because no matter how fast you run in the wrong direction, you can never get to your destination. That is just the truth. Now, radiating pain is not left out. Numbness and tingling, weakness, muscle spasms, limited mobility, painful movement, sitting or standing intolerance, leg fatigue, foot drop. I had a patient in Oka that had foot drop and was scheduled for surgery. But God so kind, this architect is back to work as far as I know, but so far I know he's doing just fine. We give God all the glory because eventually when he went back to his surgeon was like, this must be a miracle. But it's just science and God, actually. Then loss of reflexes, painful coughing and sneezing. You know that when you cough, you exert pressure in the opposite direction and you can feel the pain radiating to the lower back and in turn radiating down the leg in cases of sciatica. So what are the complications? Of course, this guy's picture should be familiar with us by now. Looking at his face alone, you know that he's having chronic pain, paresthesia, impotence. His wife is not happy with him. Loss of body posture, even looking at the way he's sitting in the office, you can see that he's bending to the left. Muscle weakness, peptic ulcer disease as a result of the analgesics he takes, paralysis, depression, suicidal tendencies because he cannot live with this pain anymore. He thinks he wants to kill himself. Then loss of reflexes, as aforementioned, increased risk of falls, can just be in the market and just boom, he's on the floor. Anxiety, insomnia, because nobody can sleep with pain. Then we have what is called caudal equina syndrome. We'll talk about that in another topic. This one leads to a myriad of problems. That's when there's terrible compression in essential components in that area. And difficulty walking or standing is not left out. So diagnosis is very basic, but must be done by a health practitioner or a trained health professional. Symptoms must be known, physical examination, straight leg raise test, medical imaging techniques, and so on and so forth. So this is how we manage and treat sciatica. Weight management is not left out. Dieting, physiotherapy. We have to quit smoking, avoid alcoholism. Then of course, some people practice thermotherapy, rest and relaxation, Chiropractic care is not left out. And then we have surgery, because decompression surgery or 50-50 surgery, which most of my patients are running away from for reasons that we all know. And then the use of appropriate orthodox medication is not left out. We'll talk about that shortly. And the use of natural pharmaceuticals, which I often encourage because of the lack of side effects associated with that. Regular exercise is there to stimulate somatic stem cells and stimulate healing, and also prevent joint stiffness. I keep saying it every time. Do these stretch exercises. This will really help people. Sometimes I wonder why we do not completely carry out these amazing techniques. But by God's grace, we shall. Now, complications in the management of sciatica. Delayed diagnosis. Let's just talk about these things one by one, because some people always believe that it will go, no problem. But at the end of the day, it gets worse and worse, because what causes sciatica is called degenerative disc disease. Degenerative means it gets worse over time when you do nothing about it, or when you don't do the right thing. Poor compliance. Some people, when they just get some slight relief, they shout, hallelujah, they are gone. And they go back to the things that caused the sciatica in the first place. And then they are back to square one in a short while. And now looking sad again. Laziness, well, some people cannot exercise to save their lives. Old age is not left out because of the grinding and the aging processes that affect such areas. Massaging, this one is, in fact, I've spoken with people and they've told me that they were wondering why their sciatica was getting worse until they stopped massaging it. Can you imagine? They stopped massaging their lower back, and then they found out that they could even have some rest. You just keep massaging and massaging. The more you feel pain, the more you feel that you are getting something right, especially this part of the world, Africa. We believe everything has to do with massaging. If you say you have headache, they can massage your brain. If you say you have tongue ache or mouth ache, they can massage your tongue. That's not how it's done. You must have to consult a training practitioner to do this thing, so you don't damage something. We'll talk about that shortly. Fake medication is not left out. Everybody's trying to get rich quick. Wrong medication and belief. Some people believe in witchcraft. Somebody is just walking around in his land and he just feels this very sharp pain or going down his leg. Hey, somebody has put juju for me in my land and they want to kill me. It's not that. It may be sciatica. Poverty is actually a problem because of the inability to work and make money. And when you don't work and make money, one is poor and can't afford medication or treatment and all that, and then the cycle continues. Other health conditions like diabetes are not left out. Remember, we talked about sugar damaging the outer ring, this outer ring here. If you look at this picture very closely, you will see that diabetes can actually make this outer ring get weaker because of the sugar damaging the collagen fiber here, leading to this inner portion, bulging and squeezing this area. This is the spinal nerve. You understand? This is spinal cord. You can see it being compressed by this inner portion that has squeezed through this outer ring, and that is what is called stenosis, and also can lead to sciatica, because the sciatic nerve root goes from the way here, from the right side here, and from the left side there. That's why you see that sugar is not good. We'll talk about that very briefly soon. And then, of course, poor health information and understanding of sciatica. We all know, we just talked about witchcraft and false beliefs. Work-related or social applications that exacerbate the condition. Some people will not sit down in one place. They believe if you go to some churches, you find some people, nobody sent them, but they are everywhere at the same time. Sit down and listen to service for where they believe that they are not doing it, that it's going to spoil. At the end of the day, their back is now what to spoil, and their leg can now have issues. Calm down. The world will keep rotating with or without anybody. Old habits die hard. Smoking, sweet tooth, junk food. Do you know that when you take all these junk and refined carbohydrates, especially those that are very used to waking themselves up with one mountain of fufu or eba or semo or something, and with one giant pot of soup because they are trying to have breakfast, remember that will increase the amount of sugar in the blood and is also chopping away the outer ring or the annulus fibrosus that is guarding the softer portion. That can lead to sciatica when it finally damages the outer ring. Be careful what we consume, because you are what you consume. Poor healthcare and infrastructure, that is self-explanatory. Self-medication and lack of specialized health practitioner. Sabi knows when the person is having problem, just go and call the children. Oh yeah, please come and start jumping on my back. They start jumping and playing 10 on their back and all that. And they say that they are massaging it because they feel that they are feeling pain. That means something good is happening. It's not every time that you feel pain or bitterness that something good is actually happening. Then, of course, economic challenges and high cost of treatment is not left out. Wrong beliefs about sciatica, witchcraft or charms, we'll talk about that shortly, and we'll know whether there's something like that. Now, obesity can increase pressure on the spine. That is the basic, that's the most important information here. Inflammation and all that are all linked to obesity. You see that cholesterol or high blood cholesterol leads to accumulation of plaque in arteries, reducing blood flow and oxygen delivery to the sciatic nerve and other essential components in that area. You guys, that's self-explanatory. Understand? And of course, it can trigger inflammation and damages the nerve line. Remember that everything that has to do with sciatica has something to do with inflammation. You understand? Of course, that's. Ladies and gentlemen, look at the bottom right of this screen and you see this table that a lot of people are very familiar with. In fact, some people have nightmares about this table because of people like this. Anytime you go to somewhere that they claim to take care of sciatica, you see somebody like this waiting to massage your body. Please and please and please bear in mind that massaging too aggressively or deeply can cause micro tears in the muscle, stimulation and release of biomolecules that can worsen inflammation and pain. It can also cause temporary numbness or tingling. Scissors effect, that is when the bone on top slams on the bone below. And guess who is in the center? The sciatic nerve roots. That one has gone. That leg can be paralyzed or something terrible can happen to such a patient. Please and please, let's just take note that if you meet something like this and you're not sure of where you are, kindly run for your life. We've talked about sugar, and we've talked about sugar, especially refined sugar and carbohydrates. You know what it can cause in regards to sciatica. Don't even forget that it can lead to insulin resistance, which is another name for type 2 diabetes. Because when you hear somebody that doesn't want to let somebody know that he's having type 2 diabetes, just say you're having insulin resistance. The person will not know that is type 2 diabetes in the making, mostly. So you can see like this delicious thing that is at the lower bottom right of my screen. I know some people here, their mouth is already watering. They want to put their hand inside the screen and collect this thing. These are the things that lead to what? Spondylosis and sciatica. That's what we're talking about. Well, peptic ulcer disease, of course, we all know that basically we have 3 major types: esophageal, duodenal, and gastric. Of course, but the chief cause of this problem is Helicobacter pylori. I brought this up because we already have treated this topic before, but let's bear in mind that as a result of excessive use of analgesics, one can find themselves having peptic ulcer disease. Diabetes and sciatica. We're talking about sugar again. But this time around, the ability of the body to handle or manage sugar has been compromised. That means the amount of sugar that Mr. A can consume and feel all right, Mr. B can consume and land in the hospital. That means that the sugar is not being controlled or regulated adequately. That's why we see the person having diabetes. Diabetes is just basically elevation of blood sugar level above normal. That's just basically what it is. Witchcraft and sciatica. Please and please and please, witchcraft has nothing to do with sciatica. Please, it has nothing to do with sciatica. You can see this witch over there wondering what she has done to the person that is accusing her that she's the one that caused sciatica. Well, please, it is not possible for somebody to throw sciatica at somebody or put sciatica on the floor for somebody to step on. It actually often starts from lifestyle choices. Imagine somebody weighing like an elephant accusing another person of witchcraft, that the person has caused sciatica for him or her. Please and please and please, let's just scrap all these things and go and look for solution to the problem and find how to elude or avoid such a problem. Now, chemical intervention is not left out. Because a lot of people like chewing these things like chin-chin because they know that when they take it for a while or a couple of minutes or hours, they will have some relief. But bear in mind that a lot of these things have certain issues we're going to talk about after this slide, most likely. Muscle relaxants are not left out. I'm not saying that you should not disobey your health practitioner based on the prescription you are giving, but please and please and please, let's try to solve our problems from the root cause rather than just solve them from the surface. Imagine somebody that is weighing like an elephant and you want to even go for surgery for sciatica. After that surgery, begin to prepare for another surgery, because what led to the sciatica happening, which is the spondylosis, as a result of the overweight, is still coming back again. So don't even bother. So anybody that is trying to perform surgery on you and you're weighing 120 kilograms, that person, just leave that person. That person does not know what he or she is doing. That's how because you must have to bring down your weight first. Because the moment you come down from that theater bed and your weight compresses the titanium rod and everything they put there, back to square one again. It's just a matter of time. Now, those other anti-inflammatory drugs, of course, we all know that they eventually can lead to other issues, but of course, they give temporary relief. As you can see, that's part of chemical intervention. Corticosteroids are not left out. Opioid analgesics, we'll talk about that shortly. Anticonvulsants. So people don't know that they're taking drugs that are anticonvulsants, drugs that are for people that are having seizures, but they're just swallowing it because they gave them the nurse to. They swallow it beyond the prescription. Be careful. Epidural injections, not uncommon. And then we have oral steroids as well and antidepressants because of the pain and frustration associated. What are the common side effects? Now, for the first one, the non-steroidal anti-inflammatory drugs, stomach upsets, and so on. Muscle reluctance, drowsiness, and so on. Corticosteroids, weight gain, mood changes, insomnia, and so on. Opioid analgesics, constipation, nausea, vomiting, drowsiness. Guess what? Addiction and dependence risk. Increased risk of dependence and addiction, not left out. Then respiratory depression, which is often rare but happens during overdose, because addiction can lead to overdose. Then we have anticonvulsants, can cause drowsiness and dizziness and all that. Then guess what? In some cases, suicidal thoughts and so on and so forth. So I'm not saying that you should disobey your health practitioner, but apply wisdom. Is healing sciatica possible without surgery? That's a powerful question. That's where we have been rushing to since. So let us take our time and look at what I'm going to be showing us. So at the end of the day, I want us to answer for ourselves whether it is possible or not. I discussed something like this recently when we were talking about spondylosis. But of course, what are somatic stem cells? But that's what we're going to. Now, these are cells found all over the body that have the ability to become any cell in any damaged or affected part of the body within their locality. Hence, they are indicated in healing the body. So, let's go to our, let's go to our universal school. That's Google. Please be careful when you go to Google. You need to go there with guidance so you don't give yourself high blood pressure. But of course, we're here to learn, and I've done a bit of research. So now, somatic stem cells, also known as adult stem cells, are cells that maintain and repair tissue in the body. That is basically what we need to know there. The next thing is spinal, vertebrae, and intervertebral disc have what can repair them, which are somatic stem cells. And this information is vital, considering that anywhere we have somatic stem cells, what healing is possible. As you can see. So I asked Google, said, do we have somatic stem cells in the vertebrae? And Google said, yes, that is correct. The vertebrae, which are the bones of the spine, contain somatic stem cells. I asked again, I said, do we have somatic stem cells in vertebrae? I asked on that way, and Google said, yes, there are somatic stem cells in the vertebrae, blah, blah. And then I asked, do we have somatic stem cells in the intervertebral disc? That's the padding that gets chopped off during spondylosis and that causes the sciatica. And Google says, yes, progenitor cells within the mesenchymal stem cell properties are found in intervertebral disc. That's Google talking, not me. You can actually copy this and go and browse on your own and see. Then we have, can intervertebral disc heal? That is where you hear people saying that it's only surgery that can solve their problem. When somebody comes to the hospital and the first attempt is only surgery. But look at what Google is saying here again, not me, that yes, an intervertebral disc can heal itself to a certain extent. Please, if the certain extent is 99.99%, is it not something amazing? You understand? So that's it. With most herniated discs, improving over time without surgery. Let me zoom out so that you can see. Look at it here. Without surgery. So a lot of people, when they just go into somewhere, you just tell them, oh yeah, prepare yourself for surgery. And they begin to prepare themselves. Beautiful. We are back. We almost lost our slide. So, yes, a lot of people are told that they cannot have any successful, they cannot solve their problem without surgery. But you can see that in many cases, surgery may not be needed. That is what Google is saying in a lot of cases. And you can see that, and they're giving the reasons why over there. Now, I now went further to ask Google, is sciatica treatable without surgery? And the first thing I'm seeing here is, yes, sciatica is usually treatable without surgery. In fact, 80 to 90% of people with sciatica get better without surgery. Can you imagine? So there's no need to be asking me, Dr. Drugs, is it possible for this thing to go? Is it possible for me to get better? Look at it here now. I'm not the one that is saying it. I asked again, I said, is sciatica caused by stenosis? That's the one that a lot of people are wondering. What they keep asking me, what is this stenosis? What is this stenosis? Who is it? And like it's not. So, it's just narrowing as a result of the issues we discussed about. So the part, the spinal cord is being compressed and all that, or the nerves that are within that area can get compressed. And that's what is basically what is stenosis. In fact, I had someone send me a message saying that stenosis cannot be handled except one performs surgery to maybe take out a portion. Yes, we are aware of that, but let us see what Google has to say about that. Now, Google says, yes, sciatica caused by spinal stenosis can be treated without surgery. Though surgery may be an option if other treatments do not work. That means there's a possibility of this thing to be treated without surgery. I don't know, some people, before you know what's happening, they're flying like Superman into the theater. I don't know what's going on. But what we are seeing here is that it is possible. So I believe that we should all try to explore all possibilities. Of course, follow the instructions of your health practitioner, but let us always apply wisdom. I still asked another question again. I said, is sciatica caused by disc herniation? This is very popular in the test results that come around. Is it treatable without surgery? And Google says, yes, sciatica caused by herniated disc is usually, that means even normally, is usually treatable without surgery. In fact, about 90% of people with sciatica improve without surgery within a few weeks. Can you imagine? So you can see. Now, I went further to find out why is it that this is possible. And I asked Google a question. I said, do somatic stem cells help treat sciatica? Brothers and the Lord, I'm not the one saying this. And you can see, according to current research, they did not say past, current. Yes, somatic stem cells, particularly mesenchymal stem cells, show potential to help treat sciatica. At this point in time, I don't need to say too much. But I want to ask us this question. From what you have heard and seen so far, I want you to type in the chat box, do you think that based on the above evidence, can sciatica be treated or healed without surgery? Please type your answer true or false or yes or no in the chat box. I'm going to check, do that right away so we can see. Because if we have somebody that has things otherwise, maybe we should learn from such a person. We are all here to learn. But from what you have seen so far, what do you think? So type that in the chat box and we'll find out. Talk about it. Now, you see, natural pharmaceuticals, we talked about that earlier. These are just biomolecules that have therapeutic activity that occur naturally. And they help to reduce inflammation at the affected spinal joint. let's not forget that they are standardized. That is why they are called natural pharmaceuticals. That's why I call them natural pharmaceuticals. But I call them natural pharmaceuticals because they are standardized. It's not like you have something in a bottle where you don't even know what it contains or what the active ingredient is. Now, they help to promote healing of damaged sciatic nerve and nerve roots, replace lost minerals. Of course, you know that the joints, heal damaged nerves. That's, of course, we talked about that. Treat peptic ulcer disease that often occur due to analgesic use and abuse. Provide essential materials for joint healing like collagen and hyaluronic acid, which, of course, hyaluronic acid is the grease, nature's grease at the joints. They help to enhance production of extracellular matrix. That's the major component of the padding. Protect DNA from damage, protect and improves muscle mass, enhancing posture and stamina, resolve sexual dysfunction. Of course, a lot of people that have these issues eventually have loss of entanglement facility performance. Then, of course, they help in weight management. Remember that being overweight is one of the major risk factors. Then they help against depression and suicidal tendency. And they, of course, they help to counter the comorbidities of menopause, which includes spondylosis. So you can see, so on and so forth. Now, these things I'm about to show us are actually where you can find, just a place you can find these biomolecules. I want us to focus on the active ingredients. I'm not saying that you must buy what you are seeing on the screen here, but this is what I use for my patients, and I get amazing results. Those patients that you've heard of, or those that have been sharing their testimonies on social media, I often add these products there because of the biomolecules. But you focus on the active ingredients and focus on what they can do. So if you can find the active ingredients anywhere, good luck. But if you're my patient, this is what I'm going to give to you. I use Forever Living products because they have been here for about half a century and they don't have anything like compromising of standard or anything. They will never reduce their standard for anybody, and that's why I'm using their products and getting good results. So please focus on the active ingredients. Now, if you look here, you see that there's something called Freedom. The active ingredients include chondroitin and glucosamine sulfate, methyl sulfonyl methane. Remember, focus on the active ingredients. Then stabilize aloe vera gel, that's a somatic stem cell stimulant, and so on and so forth. Now, this helps to improve padding and, of course, the somatic stem cell stimulation. We're talking about stem cells since I did not mention that stem cell they put under the tongue or the one that they swallow and all that, because we know that those are scientifically fake. You cannot put stem cells through your sublingual cavity and then it will pass through the cells that form by a barrier in that area. It is fake. It is not true. If you know anybody that feels it is correct, let the person contact me. I'm here. Understand? Because I know that it is not correct. The hydrochloric acid in the stomach will destroy any cell that gets there. Well, they may be selling or promoting very potent antioxidants, but it is not somatic stem. They are not somatic stem cells. Short. They are not, because we have not reached that level yet in terms of technology. Maybe in future, but not yet. So some people say, oh, somatic stem cells, at that point in their tongue, you're wasting your time. You may be taking antioxidants, which are good for you. But in terms of what we are looking at or what we are trying to target, that is not what it is. So these are just a few of the things that these things can do. Then you have what is MOVE, contains chondroitin, glycosaminoglycans, collagen, and hyaluronic acid. It's an amazing combination. But the challenge with this product is that when you have it, in fact, it's a hot cake. That's just a challenge. Just where you can find it and you can now begin to use it. So whenever you have it, and thank your God and begin to use it. So then we have calcium. Now this is unique because it contains dicalcium malate, which lasts longer in the blood and exposes that area to the desperately needed mineral called calcium, especially when there's already damage in that area with regards to the bones and all that. Of course, it also contains 1,2,5-dihydrocholecalciferol, what is also popularly known as vitamin D or vitamin D3. Copper is very important. It has been shown or hypothesized that lack of copper can actually provoke spondylosis. Eicosapentaenoic acid and docosahexaenoic acid basically have this very amazing anti-inflammatory quality. And of course, they can reduce or clean up the blood vessels around the joint area and improve blood circulation around the spinal joint. Of course, it improves nerve function and of course brain function and all. Then we have nature mean contains so many things, including copper, calcium, and phosphorus, and all that are necessary for the intervertebral disc. This is what I call small but mighty, is B12 plus because it contains cobalamin and folate analogs. Bear in mind that folate and folic acid are not the same thing. Your body absorbs folate better. That's basically what we need to know. And these cobalamin and folate analogs are very essential for what? Nerve function. Remember, we're talking about sciatic nerve as a result of that's sciatica. So we're talking about the sciatic nerve. That's why this is very important. Yeah. I always tell people do not massage. So these are the creams I give my patient. I say just apply this during the day, apply that during the night. We talked about methylsulfonylmethane. That's MSM gel. You can see that's the gel form of it. You can apply that at night. And then the aloe heat lotion, I always tell my patient to apply during the day because it can be quite hot. If you apply in the night, you may not know when you are sleeping and you mistakenly take some of it and apply some other place while you are moving around when you sleep. Remember we said that the annulus fibrosus contains about 70% collagen. That collagen, you know, that beauticians give their clients for lovely skin and all that. Just bear in mind that collagen is what God uses oftentimes to maintain structural integrity in the body. And where the intervertebral disc and the bones at the spinal cord are not left out. So you can't do without this. You can see that I put it down here that the annulus fibrosus is about 70% collagen. So most of my patients, in fact, my patients can't escape having collagen. That's one of the things that I give them because collagen is just like those iron rods you find inside the decking where they put the concrete. They now put those iron rods to make sure that the decking is solid. That's what collagen is. So can't do without that. And you can find collagen in that infinite ferrin complex in its raw form. Then we have weight management. Hydroxycitric acid is not left out. Thermogenesis to burn off fat. Then we have chromium trichloride, of course, to help to reduce weight via regulation of metabolism of fat and carbohydrates. Then we have the Clean 9 program, which is 9 days weight loss and detoxification program. So those that are having diabetes as well will benefit from this because of its ability to bring down blood sugar and also reduce weight. Remember that obesity is the mother of what? Lifestyle disease, which include diabetes. And diabetes itself is also a disease of diseases. So let's not forget that. And so this 9 days weight loss and detox program that inculcates dieting, exercise. Dieting also includes autophagy, which is the ability of the body to consume unwanted materials and convert them to wanted materials. So when you hear people saying that the health practitioner told them that breakfast is very, very important, that they must not miss their breakfast, please help me ask the practitioner whether he or she has heard of what is called autophagy, which is giving your body some time to consume unwanted materials, and it's often effective from around 16 to 18 hours. So you can tell me that assuming you ate your dinner around 6 p.m., if you count 18 hours from 6 p.m., where does it land? Is it not 12 noon the next day? Do you see breakfast within the time range of autophagy? No. Once you're above 40 or you are within 35 to 40 or you're having a lifestyle disease, breakfast is a scam. It is not necessary. It's not compulsory. If you don't eat it, nothing will happen to you. So if you're going to eat it, make sure it's something super light. But I will advise you to drink water till 12 because in fact, the fact that you're obese or you're fat already means that you have too much food stored as energy as fat in your system. That is what it means. Nothing will happen to you. So I'm going to leave us with this. Say, you are what you consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. So we just have to be what? On the winning side. And let us kindly remember not to adjust medication and dosage without the guidance of a trained practitioner. This guy is there. You can see he's not joking. Prevention is better than early detection. There's no need for you to be obese like an elephant and you begin to ask God why later. then the choices you make today determine how healthy you'll be tomorrow. For those that have moved into McDonald's and have moved into Chicken Republic and Mr. Biggs and Tantalizers, please, I suggest you move out of that place, because if you are living there and you're eating, remember that spondylosis and sciatica are actually living around too. So don't allow them to be your neighbors. So you can see this person is choosing which door is going to enter. The first door is saying eat 20 kilograms of fufu every morning. Second door is saying sleep in McDonald's and drink all the ice cream you find in Cold Stone. The third door is saying eat healthy and maintain your weight, maintain a very good weight, eat healthy, balanced diet, as well as take your natural pharmaceuticals and exercise. So whichever door the person is going to pass will determine how the person will be tomorrow. Let's not forget that some people always blame aging as their problem. It's because they are getting old. Aging is not a disease, it only needs maintenance. In fact, one of the highest female bodybuilders, I think she's about 80-something years, and she was still winning. You could go to Guinness Book of Records and you find out that the woman was still contesting even at her old age and got a Guinness Book of Record award. So that means she continued to maintain herself till she got to in her 80s. Can you imagine? So that means just the thing of the mind and what you determine to do. Thank you so much for coming. And at this point in time, I'll say God bless. Oh, then remember that peptic ulcer disease is actually even more dangerous than spondylosis because it can lead to bleeding. And that loss of blood can be terrible. Like the person will be like someone that was used for rituals, vomiting blood and all that. And it's a very horrible thing. And the pain is out of this earth. A lot of people, some patients wake me up call me in the middle of the night crying that their stomach is killing them. And eventually it's ulcer. So please be careful. So once again, on this note, I'll say good night and God bless. Bye.